Some miscellaneous issues that come up from time to time. Some patients talk about getting red flashes, white flashes, pixelated colors. Have you heard that from patients, and can you explain what's happening?
Yes, certainly a lot of patients will report these positive visual phenomena. And actually, the story about the exercise, I had a patient recently who mentioned having these very funny flashing lights and colored lights after bouts of heavy exercise. So essentially, as Valeria and Alfredo mentioned, we're dealing with an optic nerve which has been damaged here, and these retinal ganglions that are still left, some of them are not working at full capacity. So conceptually, if there's something else which is stressing it, whether it's an illness, whether they've been exercising very heavily, that could induce these signals to be transmitted the wrong way and therefore produce these positive phenomena.
Right. Positive visual phenomena are largely due to imbalances. Those 1.2 million fibers work in interesting balances. That, as a matter of fact, half the fibers tell you a light is on, half the fibers tell you the light has gone off. They're on fibers and off fibers. A lot of them says this is red, a lot say this is blue, and these that say this is green. None of them, by the way, say this is white. So how is it possible that when you're looking up here, you see me holding up a piece of white paper? It's because your brain has seen the balance that the red, the blue, and the green are in exact proportion, and that adds up to white. Well, supposing that the reds were out of whack, you would see this as the opposite, purple. So anytime that there is an imbalance, there's a tendency to misappreciate, misperceive, and that's where these positive visual phenomena come in.
Yeah, I want to add a couple of things. So these phenomena frequently are happening when you lose vision, but, and this is a observation that has no proof, but it's anecdotal, but it's something that happened to me frequently. This phenomenon also preceded the recovery of vision. And as Alfredo said, when you have an unbalanced way of transmitting this signal through the nerve, through the fibers in this cable, this is the result. So I have a personal theory that some of the fibers are not correctly wrapped by myelin, which is like a plastic wrapping to isolate the single fibers. If this myelin is partially destroyed by the disease and is reconstructed, because this is happening, at that point the fiber is able to fire again the signal. So the period where you have this dynamic process of restarting signaling through some of the almost dead fibers and getting them back to function, it's probably generating this sort of positive symptoms that are recognized. So not necessarily this is a bad, is a negative symptom. Actually, it could be interpreted in some cases as preceding the recovery of vision. What we don't know is also how much plasticity in the cortex is actually happening, and this is something that should be studied seriously with a well-organized research program with functional MRI, because obviously the brain gets less signal, but the cells can be reorganized in ways of maximizing the signal is getting, and so the plasticity of the brain is something that we don't know yet. Do you have any?
Yeah, absolutely.
And how about, some people talk about having hallucinations or Charles Bonnet symptoms. Can you talk about that too?
Charles Bonnet syndrome comes about from any cause of blindness from both eyes. So the brain needs to get a signal, expects a signal. And the easiest way to understand Charles Bonnet syndrome is if you're over 60 years old, you may remember there used to be telephones with a little dial that could change the volume on it. Or imagine even a modern telephone, a cell phone, that you can change the volume. And what would happen if you started going deaf? You'd keep pushing that get louder dial until you'd finally be picking it up to such an extent that you'd be getting static. Well, that's what Charles Bonnet syndrome is. So the brain keeps saying louder, 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 and amplifies the signal to where things that aren't even part of the signal, noise, gets picked up. But in the brain, noise isn't like a little lightning bolt. That sort of static isn't the case. It can be incredibly clear visual images. And typically they involve sharp images of little animals or colored. So imagine if you saw a little pink elephant, you'd say, I'm going crazy. No, that could be Charles-Bonnet syndrome from any cause of vision loss bilaterally, including Leber's. So it's awfully important to know that it is not a new problem. It's not the brain malfunctioning. It's just the brain that's starved for information. And typically the brain figures this out in time. And the majority of patients who see images will stop seeing it after a few months.